Back to the Sunday Show with Donald Nelson and...
All right, we want to thank our listeners for sticking with us during the break, and we're excited. We've got some new stuff going on. Now, just in case you are wondering and people have called, we are not at the point where we are live streaming. So you can hear us and engage in it, and you can go back and view it later. There will be a channel on YouTube, I believe is how it was explained to me. And at some point, we'll kind of communicate that to you. But we are excited. We got John Mullins with us and Dr. Fortenberry and Dr. O'Donnell as well. Now, Dr. O'Donnell, I'm assuming we're going to kind of go to you here. As a primary care physician, I don't know if you often see brain injuries or shaken baby syndrome or folks with, dealing with concussions and sports-related injuries and that kind of thing, but my assumption is that that's not something that's really prevalent. Just kind of help me out there and clear the air, because I could be wrong. I've been wrong once or twice before.
Actually, Phillip, it is. Every 23 seconds, one person in the United States sustains a brain injury. Falls are the leading cause of traumatic brain injury. The highest, of course, being children between the age of 0 to 4 and adults between over the age of 75. And that's typically where I come in. It's one of the most motor vehicle accidents, of course, I have to say that is one of the most leading causes. But when you talk about falls and you talk about the elderly, you have to take that into account, because every 7 minutes someone dies from a traumatic brain injury. So it's very prevalent. In addition to falls, when you talk about older people, you have to talk about medications. You have to talk about Coumadin, which we briefly mentioned. Coumadin, it's not, and I don't want to give Coumadin a bad rep. Coumadin is very useful for what it does, but typically, if an INR is greater than 3, then you increase your risk for a bleed. And a bleed is a type of traumatic brain injury. So if you're on Coumadin, you have to be careful. You got to eat what you're supposed to eat. No, you can't eat the greens today and go to the doctor on Friday, because we typically check your levels once a month. And so it's important for you to be compliant with your therapy, because INR greater than 3 can increase your risk for intracranial bleed. In addition to that, we have come out with new medications like Xarelto, Eliquis, Pradaxa. And these medications, any type of anticoagulation, whether it's Coumadin, whether it's aspirin, whether it's the last 3 that I mentioned, can increase your risk for a bleed. However, what our studies have shown is that Xarelto, Pradaxa, and Eliquis decrease your risk for a bleed less than Coumadin does. Okay, so you're less likely to have an intracranial bleed with the other medications than you will with Coumadin. And that's why we're slowly, gradually changing people over to these meds. Not everyone is able to take this type of medication. But meds are increased risk for traumatic brain injury that we have to be aware of. And that's typically where I come in. In addition to that, you can have hypertensive hemorrhage from elevated blood pressure, and that's typically what I see. And I'm going to stop at that point, because I don't want to get into strokes, because you can kind of get it, that kind of leads to strokes. But as an internist, I do tend to see some of this. It's unfortunate, but I do tend to see some of it. And I don't want to frighten your listeners, because the majority of the people that come to the emergency department for traumatic brain injury are released to go home. Okay, so even though we do see it and it can cause disabilities, they're typically released to go home. So you may ask, okay, Doc, what are some of the symptoms of a brain injury? Say I'm in a motor vehicle accident, or if I fall, I'm at home and I fall, or mom falls and she hits her head. What are some of the things that I should look for? Well, some of the symptoms are headaches, nausea, and vomiting more than 3 times within that short period of time, within 6 to 8 hours, okay? Bleeding, swelling at the site, bruising at the site of the injury, bruising of the scalp, feeling tired, fatigue, malaise all of a sudden, mood or behavior changes, something that's outside the norm for that person. Mom wasn't acting like this before she fell and hit her head. Now something's not right, Trouble walking or talking, seizures, passing out. Those are all symptoms that can occur with a concussion. So when should I call my doctor? When should I take my parent? Or when should I go? And when should I take my son that was playing football? When should I take them to the hospital or call my doctor? If they have a headache that gets worse, or just a headache from the injury, you have an injury and you have a headache. We talked about the vomiting. We talked about the change in thinking. They can't focus. They can't come up with things all of a sudden. Someone that's sharp. You get a high school student that can't tell you what they knew previously. That's a problem. That can be a problem. Of course, if they have a seizure or they can't walk, you can't keep them awake. I'm so sleepy. I'm so tired. All of a sudden, I just want to take a nap. I just want to. No. They don't take a nap. And even afterwards, once they send you home from the emergency department, and I'll slow down here. Even afterwards, when you go home and you're checked out and the doctor say you're okay, typically they recommend you sleep about 2 to 3 hours at a time. And then you wake up, because we still need to kind of watch you for a little bit. If it's going to be okay, typically things clear within about 1 or 2 weeks, but sometimes it can take up to a month for some things to clear. And Charles is going to talk a little bit more about this, but what happens after your release? What happens after, you have a concussion?
Sure. I always get the question after I release a patient with a head injury, and maybe it even involved loss of consciousness, can I let my daughter or my son go to sleep? And after the emergency evaluation, after a head CT, which is showing no bleeding, no injury, the answer is yes. Let them go to sleep. Don't keep them up all night. It's kind of reflexive. You think, well, how am I going to reassess the person? But once they're released from the emergency department, or once they've been assessed, usually your treating physician will say, fine, let them get some rest. It's been a long, hard day for this person. That's always I always get a sigh of relief when I give them that information. But yeah, I totally agree with what Dr. O'Donald said. And recovery from a concussion can last 3 minutes, like in the case of Dr. King.
Mm-hmm.
He was down for a moment, hit by the stone, able to get up and carry on. Or it can take 3 months or even years, because usually there's some component of diffuse axonal injury, as we discussed. Anytime you get that level of force, if you're hit hard enough to knock you out, there's going to be some injury. And even though we're not able to see it with our current imaging modalities, you can just tell by the behavior of the person and those symptoms that they manifest down the line.
Can you clarify something for me? And I'll remind our listeners, 903-794-1047 if you want to call in. But clarify something for me. The word concussion is pretty commonly used. I don't know if people really technically understand what the word means. And I don't know if people use it and they, just because it's common usage and they don't really know, Tell us, what is a concussion?
Sure. My definition of a concussion is brain injury that results in, let me back up. My definition is a symptomatic brain injury. And the symptom could be a brief loss of consciousness. The symptom could be a headache. The symptom could be nausea, vomiting, any of those other symptoms of brain injury. But I call it a concussion anytime there's a head injury that's associated with a symptom.
Okay.
Simple definition, but it kind of works for me. It's a good working definition for me.
Okay.
And it kind of leads into our discussion of chronic traumatic encephalopathy, which probably more commonly known as CTE. I'm sure Will Smith could give us a nice seminar on that. He played the part of the physician who brought that issue to the forefront in that movie, Concussion.
Okay. Okay. You indicated that recovery could last anywhere from 3 minutes, 3 hours, or whatever the case may be.
Mm-hmm.
And you used Dr. King as an example, to years. So, and I know you're not dealing with athletes, but being in your profession, you'd have somebody. At what level of recovery are they looking for before they let a player go back out on the field?
The NFL has instituted a concussion protocol, and I haven't reviewed the criteria that they use to determine if a player needs to be removed from the game or how long that player needs to be removed from the game. But I'm sure that there's a combination of motor skills involved as well as cognitive studies. Loss of memory is one of the early signs of concussion. So I'm sure that memory and concentration and motor skills are involved in that evaluation. And if a person is not able to perform at a certain level, they're really putting themselves at risk out on that field. So I think it's a very positive thing that the NFL is doing. But again, I'm sorry, I don't know what the exact criteria are for removing a person from the field and how they determine how long they have to lay off.
Kind of give, and either of you guys can do this, your opinion. As an old football player, you look at the trends that are occurring, say, in the NFL, and it's like, man, they have just sissified the sport. You can't hit the quarterback, you can't hit the receiver, you can't do this, and I mean, but the flip side of it is, when you don't have these traumatic injuries and you don't have these guys who battle depression and can't do this, and it's like, okay, well, maybe the means kind of justify the ends, because we don't want all of these unfortunate outcomes for guys who should be young and healthy, and they can't do all of these things, and it all goes back to they played ball. So I can see where it's this thing is kind of intended and intentional, and maybe even smart, but at the same time, you're kind of uncomfortable because we creatures of habit and we don't like change. So just whatever your opinion might be on the direction that we're going, and maybe is it far enough, or is it warranted? Just what are your observations and opinions?
Here's some more numbers for you, Phillip. 75% of persons with traumatic brain injury will lose their jobs in 90 days without the proper support. I think that's pretty dramatic. When we talk about you got to allow time for the brain to rest, or within the first 24 hours, let them sleep 3 hours, wake them up. It's important when you're healing from a concussion to allow your brain to rest. And I even read an article where it talked about high school students shouldn't necessarily, if they have had a concussion, shouldn't necessarily go back into the classroom immediately, because they need time, their brain needs time to rest. Now, how long does it take? I don't know that protocol, 2 or 3 days, maybe. It just depends, and it depends on whether or not they're having symptoms. So it's serious. And here's something else that's important. Typically, after a concussion or a traumatic brain injury that's mild, a person can learn new material, but it's the old material that's affected. So if you're talking about football players, he probably can go out there and learn the new skills, but what he had before, if he's still in the recovery mode, that's what they lose. So that's what you see. They're not quite performing up to par because they need time to rest. They need time to recover from this. Because he's not going to, if you're going to lose some of that, or I won't say lose it because that indicates you might not get it back. But if you have difficulty obtaining what was in there before, after the concussion, going forward, that's going to be an issue. Yeah, I can learn the new plays that the coach gives me, but what about before? And that's what they struggle with. And so you do need time to, get back to your baseline. That's important.
Okay. Look, you mentioned the accusation of sissifying the sports, and that comes out of Charles Barkley's mouth quite a bit. And those players from that particular day, because we had to put a shield up for what may come out of Charles Barkley's mouth, because he just let it come on up when his brain sometimes is not
I think that's indication
Yeah.
of traumatic brain injury.
He just happened to be lucky
What comes out of his mouth.
that he has a lot of money. But and we sit and talk about that, and I'm probably from that generation too. I can remember those days. But I think what really sissified the sports are those lawsuits. Guys want to know, well, why those lawsuits will actually change your mind. Mm-hmm. And a lot of things that were allowed to happen in those days and, kind of overlooked it. And I guess they're going to get into that when we get into CTEs. Those things are not, we live in the most lawsuit conscious nation.
Yes,
that's right. And so I think the lawsuits really sissified the sports. Okay?
Well, and the other side of it is, I like to see a good game. And I like to see the best players playing at their best, especially later in the season when you're getting into the playoffs. It's always been very frustrating to me that after the long season and, you're following I guess I don't play fantasy football, but I guess a lot of people do, and they have a favorite player. And this person is now out of commission because of some injury. So the other side of it is, to make the games better games, you have faster moving, quicker reacting players. Protecting them makes a lot of sense. The game, football is not martial arts. The objective is to score points. It's not to injure your opponent. So I'm okay with a lot of the rules that are protecting the players.
I don't know if all of that's entirely true. I know a whole lot of linebackers. Their objective is not only is he gonna get hit, he finna hurt, and he gonna remember me.
Yeah, and I said years ago in sports that the objective was to tackle. Well, tackle is gone out. Anybody worry about tackling? It's hitting. But it used to we tackle a guy, but you don't hear anybody want to tackle a guy now. They want to hit him and punish him and that kind of thing. So back to the very special people. About 3 minutes.
Now, in these last 3 minutes, and I don't know where you want to go, but we talking about concussions, and and we talked a little bit about football and youth sports and falls and all of that, but we didn't bring up, because when you started talking about Will Smith, my mind went to when he played Ali. So anything that we want to kind of get in there as far as Ali or boxing or that kind of deal may be concerned, because that's where I thought you were going in.
Sure. Yeah, I didn't make that connection, but he did play Ali. He did a pretty good job. Mm-hmm. And it often comes up, the question about Ali's mental status and his progressive neurological issues always comes up when the discussion of concussions is going around. And it's really been unsettled. He was diagnosed with Parkinson's disease, and from what I've had a chance to review, Parkinson's disease, of course, is made worse with repeated head trauma. So it's very unclear if he had CTE or was it just accelerated Parkinson's disease. After all, his Parkinson's started at a relatively young age, and it's not clear if that's a part of his family history. If folks in his family have had that kind of problem, or if it maybe is strictly related to the brain injuries. One thing that we do know about CTE is it's a diagnosis that's made by the pathologist using samples of the brain, and the brain is examined under a microscope, and there are very certain certain clusters of proteins that they look for, and certain certain configurations of the neurons. Ali, unfortunately, did not have that kind of autopsy, or I don't think he had an autopsy at all. So the question will remain open whether his symptoms were related to CTE or was it strictly Parkinson's disease.
Okay, Dr. O'Donald, we have about 2 minutes left, and I know you have some closing remarks you'd like to make.
Oh, sure.
Okay.
The majority, what I'd like for the listening audience to understand is that traumatic brain injury is very important, but the majority of patients with head injuries are treated and released from the emergency room.
Okay, all right, okay. Well, it looks like we didn't get a chance to get back to Mr. Bennett today, okay, but we will, okay, and we never have enough time on the brain. People with the kind of expertise that the doctors have. But Phillip, it looks like we've had another great show. I had some more great people with us, and but our time is up. Unfortunately, we have to pop pump the brakes.
That is all for this edition of the Sunday Show. We wish that we could be here longer on this 15th day of January. We hope that you've enjoyed the show. Certainly appreciate those of you who called in. And again, I'd like to express my appreciation to the 42% of you who did not vote. And we're going through this transition in large part because of your apathy.
Okay. Now on behalf of my brother from another mother, Phillip O'Donald, and the great and wonderful people here at Texarkana Radio, thanks for being you and tuning in to our show.
Remember, you're listening to KTOY Radio 104.7 FM, the station that cares about the quality of your life, the soul of the city.
Please stay tuned now for Miss Dee Dee Woods and her show Inner Visions, which comes to you right after our show each Sunday morning. Check emails and be sure that they've not been hacked. And remember, this show is not rigged. Remember, this show comes to you each Sunday morning from 9 until 10 a.m. We appreciate your support and helping us to continue to make America great. It's already great. Be blessed and have a great week.
KTOY Sunday Show on 104.7
All right.